Today's topic of discussion is interior of pharynx. So first let's orient the specimen. This is the anterior, posterior end, superior and inferior. We are seeing the base of the skull. This is the basilar part of occipital bone, and posteriorly we are seeing the sections of vertebral bodies. So this is anterior arch of atlas. This is the body of C2 and the odontoid process, body of C3, C4, C5 and C6. So, pharynx extends from the base of the skull superiorly to the lower border of the C6 vertebra. Pharynx is divided into three parts: nasopharynx, oropharynx and laryngopharynx. Nasopharynx extends from the base of the skull and up to the soft palate. So, you are seeing here this is hard palate and this is the soft palate, and this is the lateral wall of the nose and the nasal cavity. The boundaries of nasopharynx: anteriorly it communicates with the nasal cavity. Posteriorly it is supported by the basilar part of occipital bone, anterior arch of atlas and C2 vertebrae. Inferiorly it is continuous with the oropharynx through the nasopharyngeal isthmus. Now, what are the features present in the nasopharynx? On the lateral wall we see the opening of the auditory tube. So, the probed opening is the opening of auditory tube, and over the roof and the posterior wall of the opening there is an elevation. This elevation is called as tubal elevation. The tubal elevation is produced by a tubal tonsil, which is a part of Waldeur's ring. Now, behind the tubal elevation there is a deep recess, what we call as fossa of Rosenmuller. This is the roof of the nasopharynx and the location of the nasopharyngeal tonsil. The enlarged nasopharyngeal tonsil are known as adenoids. Now, over to the oropharynx. Oropharynx extends from the soft palate to the upper border of epiglottis. This is the epiglottis. So, this much is the extent of the oropharynx. Anteriorly, the oropharynx communicates with the oral cavity. So, you can see the tongue, cross section of the tongue. This is the muscle genioglossus. This is the oral cavity. And the oral cavity and oropharynx are communicating through the oropharyngeal isthmus. So, oropharyngeal isthmus, superiorly it is bounded by the soft palate, inferiorly by the epiglottis and laterally by the palatopharyngeal arch. Posteriorly, the oropharynx is supported by C2 and C3 vertebrae. Over the lateral wall of oropharynx, here you can see the palatine tonsil. This is the palatine tonsil located in the tonsillar fossa. The boundaries of tonsillar fossa are anteriorly the palatoglossal arch, posteriorly palatopharyngeal arch. Apex is the meeting point of these two arches at the soft palate, and base is formed by the posterior part of the tongue, dorsal surface of the posterior part of the tongue. The oropharynx communicates with the laryngopharynx, which is situated below it inferiorly, and the laryngopharynx extends from the upper border of epiglottis to the lower border of C6 vertebrae or the cricoid cartilage. Now, before seeing the features of laryngopharynx, let us orient ourselves to this part of the section, the sagittal section of head and neck. So, anteriorly, as we told, we have here, this is the section of the mandible, this section of hyoid bone, this is thyroid cartilage, section of thyroid cartilage, anterior arch of cricoid cartilage, and this is the posterior lamina of cricoid cartilage. This here is the position of arytenoid cartilage, epiglottis, and this fold is eriepiglottic fold. So, this is the laryngeal cavity in front of the laryngopharynx. So, anterior wall of the laryngopharynx we have the inlet of larynx, and also the posterior surface of the posterior lamina of cricoid cartilage. On the lateral wall of laryngopharynx, there is a mucosa lined depression. This depression is called pyriform fossa, which is bounded medially by the aryepiglottic fold. This is the aryepiglottic fold, and laterally by the mucosa covering the lamina of thyroid cartilage. This is about the pyriform fossa. അടുത്ത സ്പെസിമെൻ കൂടെ കാണിക്കാം. In this specimen, we visualize the pharynx from behind. So again, let's orient ourselves. Can see the tongue, anterior 2/3 of the tongue, posterior part of the tongue. This is the epiglottis, upper border of epiglottis and lateral borders of epiglottis. Here you can see the glossoepiglottic fold, medial and lateral glossoepiglottic fold, and this is vallicular. So you can, what you are seeing here, this is the posterior pharyngeal wall. Once we open the posterior pharyngeal wall, we are now inside the cavity of pharynx, and this part is the laryngopharynx. So laryngopharynx, the probe is now inside the laryngopharynx. Anteriorly, this is the laryngeal inlet bounded by epiglottis, aryepiglottic fold and the interarytenoid fold posteriorly. And here anterior wall has the mucosa covering the posterior lamina of cricoid cartilage. On the lateral wall of laryngopharynx, this is the pyriform fossa. On both sides you can see the pyriform fossa bounded medially by the aryepiglottic fold and laterally by the mucosa lining the lamina of thyroid cartilage. The pyriform fossa contains internal laryngeal nerve and superior laryngeal vessels. Thank you.